So stepping into a new year, the government has announced the reopening of face-to-face classes yet again. This follows the recent spike in cases after news that the more contagious Omicron is present here in Jamaica and children being more susceptible to the virus.
Yeah. Here to discuss is Dr. Carolyn Gomes, board member, the Developing Country NGO delegation to the Global Fund Board. Morning, Dr. Gomes. Nice to have you.
Dr. Gomes, I haven't seen you in so long. What's up? How are you?
I know. I'm good, Neville. I was just thinking about a particular time we met on the mound, but we will leave that
Yes.
there. Hi, Daily.
when I heard that you're coming, I told everyone she's usually on this show many times, but I haven't seen her for so long. Great to see you. Happy New Year. I hope all is well. I hope all is well with you and your family.
Yes.
You don't buy the face-to-face just yet, or no?
Oh, no, I'm not arguing that we shouldn't get our kids back to school, because it's quite clear we need to get them back into classroom learning. Mm-hmm. What I'm concerned about is what we are doing to ensure that they can stay in classroom learning. And where I sit, Neville, I have been working on this COVID things for the 2 years now, particularly the international response. And one of the things that Jamaica has not done and is not doing well is testing. And not making it available readily enough. They're not making it free. And we are not testing asymptomatic people. The government isn't. If you have money, of course, you can go and get a test anytime you want. Mm-hmm. And so when we send our kids back to school, we have to put into place some plan that allows for them to be tested frequently at the school gate.
What is frequently?
In some places, they're doing it daily. That's unrealistic for us. In England, they hand the kids something like 4 or 5 test kits every week, so they can test themselves.
Okay.
And in American schools and colleges, they test as often as they're suspicious and routinely once or twice a week.
Mm-hmm. Wow. I like the approach, Dr. Gomes, because it sounds like we're looking at the best practices and trying to find ways in which we can ensure that our children get to go to school and do so safely. What are some of the other areas from your experience or your discussion with teams across the world that we could probably take some lessons from as we continue face-to-face?
For the kids, we need to be making sure distancing. We need to be moving away from cloth masks. We need to be giving kids either surgical or N95 masks. N95 masks are difficult for kids, but they definitely need to be in at least a surgical quality mask and not a cloth mask that is forever dropping below the nose. Mm-hmm. We need to have the distance in the classrooms. That is critical, particularly in this new surge that we're having. We need to be routinely and frequently disinfecting desks, tables, chairs. We need to try and get the vaccine program ramped up for the 12 and up. And I would prefer if we were to take on the CDC and the English National Health Service recommendations and start vaccinating the 5 to 12-year-olds. Mm-hmm. And because those are the ones that are least able to control themselves with the hugging and the touching and the kissing and keeping clean.
Yeah.
And we need to be testing. I was very heartened to hear a principal, and forgive me, I do not remember what school it was, calling for self-tests to come to his school. And we're going to have to teach teachers and principals and school guidance counselors and school nurses how to administer the tests. We're going to have isolation rooms, and we're going to have to try and test often enough to nip any spread in the bud.
Yeah. Yes. You're quoted as saying that the youngsters are now showing greater vulnerability to COVID-19 infection. Is this Omicron or what?
The data out of South Africa suggests a bigger impact on kids than we had seen with the other variants, Delta and the Alpha and whatever else. There were more children that were infected. There were more children that were infected and got sick. So it seems to have, and it's still very early days, Neville, for medical research, but because we're only about 2 months into this Omicron surge, but there were definitely more hospitalizations, more kids getting sick with this new variant. There are a bigger proportion of those that go to hospital. Still small, but a bigger proportion, and seems to be a larger number getting quite sick. And so we need to be aware of that. We need to look out for that. We need to protect them as they are entering the school gate. And beyond that, if we can, kids should be getting masks to take home. They should be getting good quality masks to take home. We should have cleaning squads. We should have the teachers vaccinated. And we should, as much as possible, be testing any kid that's suspicious. Remember also that children get upper respiratory tract infections that are not COVID.
Right.
And you
Right.
don't want to be sending children home to isolate because you suspect they have COVID and you cannot test them and interrupting their schooling, in that way.
Yeah.
One of the things I've been asking for, Dr. Gomes, and it might be there, but is a clear policy. Because one of the things you just raised, if a child happens to be positive, what is the next course of action? Do you send home all the children? Do you send some? What is the testing? How often should they wear the mask? Is there a break in between to allow them some? I don't know if one exists. Do you know if one exists? A policy that clearly guides all of how we engage the children?
And all of the school principals who are making these decisions. And
Yes.
and how do we apply it to the teachers? Suppose a teacher tests positive. And that's where testing is really critical, Delia, because you could then, instead of sending home everybody, you can test. You can test them every 3 days or every 2 days to make sure they are negative and continue to be negative. And so that you can keep them in school. You shouldn't have to. England has just revised its policy on kids going home to isolate when they, because they were sending home whole classes when one child tested positive. Now they've revised that. They said they're sending children home with test kits and they're testing those in school.
Yeah.
And if they're negative, they stay in school.
You've already said that you think or you would like to see face-to-face, but having said all of what you said, should they put it on hold just a bit because of the things that they don't have at school and all those things that you said we're not testing enough and should they put this on hold?
Neville, those kind of deep and difficult political decisions shouldn't be arriving now. That should have been thought through, and hopefully, I'm hoping that it's just that we don't know that they're being thought through. Should have been done. You don't put up your hurricane shutters while the winds are blowing.
Right.
You need to know that it's coming, and you need to have all the preparations in place. You need to have bought your test kits, bought your water, bought your food. You need to have secured your house. And I'm hoping that I am just missing a plan that was there, but I'm really concerned that if we do it without this planning, we're going to end up with a situation where we're jack-in-the-boxing kids. They're coming into school for a week until somebody tests positive, and then every man jack up back home out the door, by which time they're going to infect the parents at home, and we're going to be doing this in and out, which is just as damaging as leaving, in fact, possibly worse. There's some psychological studies that suggest that when you withdraw from kids what they're accustomed, what they were looking forward to, that it's more damaging. So I really hope that all of these things have been taken in consideration. I'm worried that they haven't, and I'm calling on the government to step up particularly in terms of planning for the testing of the children in schools.
Yeah. I know we've been talking a lot about the medical aspects of it, Doc. What about the social skills? I meet adults on the road, and I'm like, oh my gosh, they've been locked up at home for 2 years. We no longer know how to speak to each other. We're so aggressive. What about that aspect of our children? I've seen some of them say, I don't know what has happened to my friends. I don't know how to relate to friends. Is that an important aspect of returning to school?
Absolutely critical, Delia. Children's development is so dependent on the interaction with people, with learning the social skills, because we are social animals. And there's real research showing how damaging staying home is.
Yes.
And how terrifying it is to a 6-year-old who's going back to school, or an 8-year-old who's going back to the school for the first time in 2 years, has been at home with a brother and 2 sisters maybe, and how damaging that is to them. They don't know how to deal with it. They don't know how to express their emotions. They haven't learned how to interact in groups. It's really, really important that we try and get them back to school, and we must try and do so school for not only the education, but that is critical, but school for the human interaction that is also critical to kids' behavior.
Yeah. Final question, Dr. Gomes, if I may change lanes just a bit. I heard about this in 2020, then I hear by summer it gone, then I hear by the end of the year it gone, then we go to 2021, and I hear by the end of the year it gone. We are in 2022, and it seems to be getting worse. Is there a light at the end of the tunnel as a medical doctor? What are you seeing down the road?
I didn't put on my priestly robes today for a good reason. I don't have no Jesus in sight. But there are a couple of theories, Neville.
Yeah.
Number one, we did not close the door on COVID when we had a chance to make it disappear.
Okay.
Corona is here with us in one version or another. It's going to be endemic, meaning it's going to come around. It's going to live in pockets in the population. Hopefully, the variant that will end up living in pockets in the population will be milder than the first variant of this coronavirus, this COVID virus, and that we will treat it and end up living with it like how we do with the annual influenza surge. I'm hoping that's where we're going, because that, having not been able to stop it from spreading internationally around the world and to cut it down in country when it came, we're now dealing with the fact that it's too deeply spread out across the world to be able to eliminate it.
Oh.
So how do we deal with it? Hopefully we end up with a mild variant that surges every 1 or 2 years, and we get vaccines to protect those who are most vulnerable to major illness with it, unfortunately. And hopefully that's this year. Omicron has some hopeful elements to it. It's not doesn't make you as sick, doesn't make as many people who get it proportionately end up in hospital. Though, of course, the way it spreads means that this surge is now going to be huge numbers in hospital. We're already seeing the rise in numbers. But when your crystal ball talks to you, please talk to me.
I shall. Amazing to see you. Amazing to see you. I haven't seen you for so long. God bless you and your family. And thank you so much for being with us this morning. Take care.
Thank you, Neville. Thanks, Daly. Have a great day.
Thank you. Dr. Carolyn Gomes, board member, the Developing Country NGO delegation to the Global Fund Board. And it's just amazing to see. As we said, we have so many discussions with her over the years. Coming up, we talk with a centenarian. Soon come.